This is a single-arm phase 2 open-label study, and there are two cohorts as we just discussed. So Sotatercept alone is given in patients who are anemic and there is no other myelofibrosis-directed therapy permitted in that cohort. And then separately, there is a cohort in which Sotatercept is added to patients who are on Ruxolitinib, and they have to have been on Ruxolitinib for at least 6 months and be on a stable dose of Ruxolitinib for the previous 2 months. So Sotatercept is added in that situation, and then in the previously mentioned cohort, that in that one Sotatercept is used alone. We've been very encouraged by what we've seen so far. What I presented at the MPN oral session the other day was that in the monotherapy cohort, where Sotatercept is used alone, we had a 39% response rate there. That was 7 out of 18 evaluable patients. And in the combination cohort, we had a 30% response rate with 3 out of 10 evaluable patients. And I have to mention here what I mean by evaluable, because it's not always the exact number of patients treated. So we had a pretty stringent definition here in this study. So in order to be evaluable, you had to be on the study for at least 12 weeks. You couldn't say have a response and then go off the study for whatever reason. So that actually excluded some people who were potential responders, who were looking like they were going to be responders, except that they did not stay on long enough. So the ones that I mentioned here, the 7 out of 18 in the Sotatercept alone cohort and the 3 out of 10 in the combination cohort, were confirmed responses that were sustained for the minimum of 12 weeks.